peeps? Welcome back to another episode of the Brew Podcast. I am your host, Mr. Cool Beans. It is Monday, February 10th, and I am so thankful that you are tuned in to another episode, my second episode of this roller coaster of this journey of mine. If this is your first time joining me here, the purpose of this podcast is to bring advocacy and awareness to chronic illness, more specifically in my case, CKD or kidney disease. I also cover the importance of mental and men's health and the journey through my diagnosis. As always, I hope that by the end of every episode that you are able to walk away with whatever golden nugget you find on my journey to help you navigate your own. No journey will ever look the same, peeps. All right. But we can always learn from one another and help us to navigate the road that we are on. Just want to say that this episode is sponsored by you guys, the listeners. Every stream, every download and share helps this podcast go just a little further and reach the world, reach the masses. You never know who it's going to hit. Definitely want to give a massive shout out, though, to my listeners out in Berlin and my home turf here in sunny, sunshine, Florida. All right. So before we begin, I have to say this. All right. This podcast is for informational purposes only and is not a medical advice session. Okay. Little disclaimer. Please, peeps, consult your doctors for any health concerns that you might be facing. All right. I am no doctor. I have no doctorate degrees in medical advice or in the medical field. I am just a patient, a CKD patient at that has gone through so many different things and would like to share his experiences on his platform. So please seek your doctor for consultations if you have any health concerns. All right, so let's kick it off. Last episode, in episode 1, I just kind of gave a little breakdown of who I was and a little synopsis of my journey. Real big roller coaster ride. I mean, 2024 just took me by surprise for the most part. A lot of surgeries, a lot of hospital visits, a lot of scans and tests and what have you. And it all pretty much kicked off with me just trying to be more healthy. I can't even imagine that this CKD journey would have started off with me wanting to be healthy or become more healthier because I was tired of how I looked, how I felt, my energy levels, and I just wanted to make a change. And making a change opened a can of worms in a good way, and I guess in some very distraught ways. But I'm glad I embarked on this journey because it showed me how important my health is. So, if you missed the last episode, I recommend you go back, check out episode 1. But for all intents and purposes, I'll go ahead and give you just a little bit of what I mean by my journey. So, like I said before, back in 2017, 2018, I was diagnosed with high blood pressure. I started taking 2 meds. Not going to name the medications, but I started taking 2 high blood pressure meds. 2 blood pressure meds became 3. 3 blood pressure meds became 4. And I almost started taking 5 blood pressure meds altogether at my young age at around 30 years old. Yes, 30 years old. I was chugging down medicines in the morning and in the evening to go to bed. And mind you, the crazy thing with that too, there would be times, especially when I got to the max amount of meds I was taking, probably like 4 or 5, I started getting some severe headaches. Like, no joke. There'd be times where I would take this one pill and I knew for sure whenever I take it, I would get monster headaches that would take me out for the whole day. And honestly, I wanted to change. I started looking at myself. I started looking at, my weight. As I said before in episode 1, my highest weight was 389. And I think I got to like 375 before I decided, hey, I'm going to start making the change. So from that 375, big progresses were made. I took my life serious because I thought that by doing these things probably would have got better for me. Funny enough, it got better in certain ways, but it didn't take down my biggest component or enemy in my health journey, which is high blood pressure. That's right. So today's episode, I'm going to be talking about my journey with high blood pressure and how that contributed to my CKD and how it kind of clashed with my weight loss journey all at the same time, which kind of made it very tricky to navigate all throughout 2024. Sorry about that. So, like I said, my highest weight was 389, got down to 375. And at that time, I did contract pneumonia for 3 consecutive years. And I remember back in 2022, the last doctor that I saw in the ER told me specifically that if I was to bring down my body weight by 10%, the effects of the pneumonia that was catching every single year wouldn't be so bad. And I don't know what dart he shot at me with. I don't know how he jabbed that into my chest and into my heart, all figuratively, of course. And it stuck with me. It stuck with me. So as soon as I got out of the hospital, I came home and told my wife, hey, look, I got to make a change. I'm sick and tired of this pneumonia. I don't want to die. I just became a dad. So I'm going to do something about it. And I started taking my nutrition very seriously. I started eating, plain old kale and spinach with some chicken and mustard. And I kept doing that. I didn't know what I was doing. I mean, I was doing little workouts, little bicycling and, little weightlifting, little wall push-ups here and there, not knowing that I was actually creating a catalyst to help jumpstart my fat loss, my weight loss journey. So as I started to see the progress, I was dumbfounded to see that I was actually losing weight. For a long time, I had struggled with my weight. And so now I'm seeing my weight coming off. I'm starting to bike a little bit more. I'm doing more wall push. I'm doing some weightlifting now, and I'm seeing the weights just shred off of me. I'm drinking protein shakes. I'm doing all the stuff that you see these influencers on Instagram or Facebook do. They're eating protein, they're working out, they're starting to do things. And I was a skeptic. I was like, man, I could never lose weight. And I literally started losing weight. And I was pretty pleased with myself because for the first time I was doing something for myself, and it felt like I was conquering my own body. I was conquering the brick walls that told me, no, I could never do it. And so as I started losing the weight, the clothes are starting to get more loose. I'm walking around with baggy clothes. Now I got to go shopping for clothes, and I'm actually wearing sizes that I never probably could wear from before. It was a pretty good time. I was getting compliments here and there, like, oh man, what are you doing? And I would joke, I'd be like, all I do is fart and sit in the corner and cry. And sometimes it felt like that because there are times where I would see my friends, chugging a nice cold one or eating some nice pizza. And I'm like, man, I wish I could take a bite, but I had to have grit, hold on to myself and just keep going with the progress because I found my why. And my why told me I'm doing this because I want to be here for my son. I want to be here to live and see more days. I don't want pneumonia to take me out when I could do something about it. And so as I continue to work out, I still struggled with my good old friend, high blood pressure. Now, I didn't know that high blood pressure could take on different forms, and I'm going to get into that a little bit. So mind you, I'm probably coming home from work as a teacher. Now, we all know how stressful the teaching jobs are. I'm coming from work, decompressing all the stuff that the kids might have done. Johnny probably, got mad at Sue and yelled in the classroom. I had to talk to him or call his mom and, all that other stuff. And then I had to teach a class and, make sure the kids are performing to their ability. And now I'm coming home every single day having to decompress. So I would go on bike rides and I'm carrying all that stress on my shoulder. And the biking was actually therapeutic because it helped me de-stress. I'm seeing trees, and mind you, I live in northern Florida. So I'm biking around. I'm seeing the trees, feeling the breeze, especially in the fall. Oh man, biking in the fall is so beautiful. It's one of the most therapeutic things I've ever done for myself. So I'm doing all of this stuff and I'm biking hardcore because in my mind, I'm thinking to myself, hey, look, your body's a machine. Keep grinding. And I'm training myself to breathe here because keep in mind, I've been having pneumonia for the past 2 years. And so I'm really doing this to train my lungs so that my lungs wouldn't be weak anymore from all the pneumonia. And I'm breathing intensely. I'm telling myself to keep breathing, keep grinding here. I'm working my leg muscles. I'm biking, making sure I get a good sweat. And I would say I did that for a good 8 months of just biking, and I would come home and I would feel so good about myself because I'm actually working out. Little did I know that even though I was biking, the blood pressure was still an issue, even when I was taking all these meds. And I bet you some of you are like, hey, look, you're taking blood pressure meds. Wouldn't the blood pressure meds have cooled you down, made sure the blood pressure come down a little bit? To my surprise, the blood pressures didn't even put a dent into the BP. There would be times where I would feel certain symptoms, and I'm also going to talk about it in a little bit. I would do all this biking on extreme, I would push myself. And as you're pushing yourself, you guys do know, like when you're working out, your blood pressure does increase. So I couldn't even imagine how much damage I was actually doing to my body. I know sometimes they say like as you work out, your blood pressure comes down after the workout. But as you're working and you're pumping, your blood pressure goes up. You know, you're wearing a ring, your fingers get really sausage like, you know, so it was something I never pieced together because I thought working out would have brought down this blood pressure and I wouldn't have to worry about it. So I would be working out, my blood pressure would still be through the roof. I would check my blood pressure at home and I would have like crazy blood pressure readings like 210 over 110. I would probably, come from work and I'd have a doctor's appointment and I would get blood pressure readings of 230 over 115, like super high blood pressure. The weight was coming down, but the blood pressure was still up, like for no reason. So I'm thinking to myself, okay, maybe it's the stress, maybe it's the this, maybe it's the that. Trying to figure out why isn't it working, or maybe I just need to work harder. And so I kept working out, all through the year from December 2023 up until from 2022, from all the way to December 2023, and then I catch pneumonia again. And this is what sends me to the ER to actually finally get the diagnosis that has changed my whole life. So I get to the ER, they do blood work, they, do some urine samples, they take my blood pressure. The whole time I felt like I was in the ER more so for my blood pressure rather than the pneumonia. They were treating the pneumonia, but the blood pressure was really the problem. And so I just remember being in that hospital bed, my wife next to me. I'm healing from the pneumonia. Mind you, my chest is hurting, I'm shortness of breath and all of that stuff. And then the doctor comes into me one morning and says, "Sir, do you know that you have stage 4 kidney disease?" And to my surprise, I'm like, "What are you talking about?" Because I'm working out. I'm doing this. I'm biking. I'm sweating. I'm taking my medicine. What do you mean I have kidney disease? There's no way I have kidney disease. And he shows me the charts and my GFR was actually 22 at that time. Now, I remember back in 2022 in December when I was in the ER previously for pneumonia, they did check my GFR and my GFR was at 54. Now, that to me signified that I was already at stage 3. And at that age, I should at least be 90 GFR and up as far as a normal kidney function. So even then, my body was telling me like, "Hey, your kidneys are not doing so well," but it was never brought up to my attention. "Hey, you might want to check a nephrologist. You might want to talk to your doctors about your kidney function." It was none of that because they probably thought I was dehydrated and I just needed to drink water and it would bounce back up. But the next year, my GFR had went from 54. Now it dropped to 22 and I'm sitting at stage 4 kidney disease. I was shocked. I was mortified because when you hear anything with disease, it could have been hamster disease. You feel like you're going to die. You feel like something tragic is going to happen if you don't take action right now. And I was so confused. I'm not even going to lie to you. I was confused out the wazoo because I was working out. I was doing all the right things. I sacrificed, not drinking beer and not eating pizza and wings and all the French fries in the world. I sacrificed all that to be healthier. And here I am sitting with now a stage 4 kidney disease diagnosis on my medical record. And it didn't make sense to me. The blood pressure was still off the charts sometimes in the hospital. I would relax, I'd lay down and it would be fine. But as soon as I get up and start moving, my blood pressure would be through the roof and they would come in and give me the meds and ask me, did I get up? Am I doing anything? I'm like, no, I'm fine. I'm breathing okay. I have no headache. I'm doing fine. So the blood pressure was the biggest culprit in this whole CKD saga. Now, before I go further with the story, I just want to kind of give some breakdown on some information when it comes to the hypertension piece, all right? So according to the American Heart Association, or AHA, it's like AHA, like a light bulb went off. High blood pressure or hypertension often has no notable symptoms. That's why it's sometimes called the silent killer. And I'm not even going to lie to you. Around 2013, when I went to UCF campus, like I shared in episode 1, I went to a clinic and the doctor told me that I was pre-hypertensive. I need to watch myself. And, being a college kid, I just wanted to do my own thing. I wanted to go out, chill with my friends, chill with my wife, hang out and do what college kids do, not sleep, study all night, eat probably the most crappiest of foods, not really taking care of myself. And I never felt any symptoms. That was the craziest thing. I never felt any hardcore symptoms in the earlier stages when it was just regular blood pressure. And I'll explain what I mean by regular blood pressure in a bit. However, though, in some severe cases with hypertension, some people might experience some headaches, some shortness of breath, nosebleeds, and even severe anxiety. Now, you do know how stress and anxiety can increase your blood pressure, not for a long time, but it can increase it, for short periods. And if you constantly have anxiety and stress, it can become chronic to that degree. However, it's also important to note that these symptoms are not specific to blood pressure and can be caused by other conditions. I personally believe the best way to know if you have high blood pressure is to regularly check your BP by a healthcare professional to monitor the trends over time. You never just want to go by just one sitting, because you probably could have been doing backflips, in your backyard, and you go check your blood pressure. Of course, it's going to be through the roof, but you want to check for the trends over time. That's why for folks who do have high blood pressure, your primary care provider asks you to keep a chart. Take your blood pressure in the morning, maybe in the afternoon, and even in the evening to see the trends, how it increases or decreases as the day progresses. And like I said, I never felt any symptoms. I was working all day. I was probably, I was a teacher. Sometimes I had to reprimand the classroom a couple of times. Sometimes I had to talk to Johnny sternly. Sometimes I was stressed out because no matter how many times I taught this same lesson, the kids probably didn't get it and I'd have to go back. So yes, there were heavy stressors. Yes, there were things happening in my personal life that probably caused some stress. It could have been family things. It could have been just personal goals that I haven't been seeing. And mind you, me struggling with my weight and maybe self-image, that also too brought on stress. And sure, there were ways that I probably, de-stressed myself, but you got to consider all of these things too that can contribute to your stress being high and increasing your blood pressure. So about that whole regular blood pressure thing, right? So all the times that I was taking my blood pressure medicine, it didn't even put a dent in the BP. It might have gone down just a smidge, but it didn't really bring my blood pressure down to a place of normalcy. And mind you, I got on the bike and started really working out, really doing my thing and changing my diet, but the blood pressure never went down. And so as the blood pressure remained high, my body compensated and felt like, hey, well, I guess the blood pressure needs to stay high for him to function, which then ensued malignant hypertension. I never knew blood pressure could evolve. Okay, like it almost felt like Pokemon. Like this regular blood pressure can be managed for sure with good diet and exercise, good sleeping habits, good stress management. It could be managed, regular blood pressure. And maybe I could bring on a medical expertise on here to talk about malignant versus regular high blood pressure, just to kind of paint the picture of what can happen in between the two. Okay, so regular blood pressure can be managed with diet, exercise, stress management, etc. Whereas if the blood pressure apparently stays too high for too long, the body can compensate and feel like it needs to operate at this level, hence why you don't really feel any symptoms and can create malignant hypertension, which is a severe medical crisis, okay? Malignant hypertension is a severe form of high blood pressure that can be difficult to manage with diet and exercise alone, okay, guys? It is life-threatening and requires immediate medical attention. And it always made me wonder why doctors stress so hard about the blood pressure, especially if I didn't feel no symptoms at all. I remember one time, and it's probably one of the most embarrassing experiences, and I say embarrassing because it was in front of my coworkers and maybe even some of my students. I remember after school one time, I had a good friend who was a nurse at the school that I worked at, and she checked my blood pressure and she went in a shock. She said, "Dude, you might have a stroke." She said, "You're not going home. I'm not going to let you drive home." And I'm like, "I'm good. I can do this." And I really was resistant because I didn't want to be pulled out of here in an ambulance, out of a school in an ambulance in a stretcher and have everybody looking at me. And that's, what that does to somebody as far as mental health wise. It makes us subconscious, especially for me. I was already struggling with my blood pressure, and now blood pressure being the cause to have me be embarrassed to be pulled out of my school on a stretcher when I know that I'm good, and I had to take that to the face. And so she did it, and I'm glad she did it. Although I was super resistant and didn't want to do it, I'm glad she did it because it was a wake up call for me. It was an alarm for me to realize that my blood pressure was not really good for me. So the stretchers came, ambulance came, they checked my blood pressure. My blood pressure was through the roof. I mean, we're talking 210 over 118 or something like that. And they carried me out. I had students who saw me, especially my homeroom kids. I had to be out for a couple days. I had staff emailing me, messaging me, and checking to see if I'm all right. And here I am just brewing because I was so embarrassed because my blood pressure. And mind you, at that time I was still pretty husky. But it happened, and I'm glad it happened. And so I was put on meds. I was told to take my medication. That's when I was put on like my fourth and fifth blood pressure medication. And after that, I really felt like, man, these meds are making me even more sick. I'm feeling the headaches, and probably because the blood pressure was becoming that much more severe. And so I took it upon myself to say, you know what? And I'll admit this. I took it upon myself to say, you know what? I'm not taking these meds anymore. Like I had a choice, really. I said, I'm not taking these meds anymore because they're giving me headaches. And you know what? I'm going to go ahead and start working out to see if I can reduce the amount of medications that I need to take. Right? Hence the biking, hence the change in diet, hence the weight loss and all that stuff. And then here we come with the CKD stage 4 diagnosis. All right. So before I jump even further, let's talk a little bit more about the blood pressure piece. All right. So if you don't know, blood pressure is made up of two different numbers. You have the systolic and the diastolic. The top number, which is a systolic, is the pressure in your arteries when your heart beats. So every time your heart contracts, it sends a pressure of blood through your arteries with oxygen so that every part of your body can receive fresh blood supply, etc. When your heart is at rest, the diastolic number is the bottom number, and that's the pressure when your heart is completely at rest. So every time your heart pumps, it's at rest and pumps and rests, and it's just the numbers that dictate how much pressure is in your arteries every single time the heart beats. All right. Now, the current guidelines by the American Heart Association and other organizations state that the reading of 140 over 90 or higher is considered high blood pressure. Okay, 140 over 90 is considered 140 over 90 or higher is considered high blood pressure. A normal BP is 120 over 80 milligrams of mercury or less. Now, this malignant hypertension is classified as 220 over 130 milligrams of mercury in your arteries. Okay, that's a strong pump. 220 over 130. I had that. I don't know how many times I saw those numbers on the blood pressure reading. And, I would say, man, this blood pressure thing is just, hereditary, and that's it. I can't do anything about it. This is just how it's going to be, and I'm just going to have to live with it. I even saw some videos, some kind of misleading videos where I had folks say, hey, don't worry about the numbers on the blood pressure reading. Just make sure you're doing what you're supposed to. No, I would say you need to worry about the numbers on the blood pressure reading because you don't know what type of organ damage can happen if your blood pressure reads that high. And that's the thing too. Hypertension or even malignant hypertension can cause some severe organ damage. It can cause damage to your brain, cause damage to the heart, of course, to the arteries, and it can even cause damage to you guessed it, your kidneys. And that's what happened to me, y'all. The kidneys got hit really bad. So let's talk about CKD now. Let's talk about CKD. According to the National Kidney Foundation, CKD or chronic kidney disease has no signs or symptoms in the early stages. You're probably like, oh my gosh. So both of these things have no signs or symptoms. And what's scary is a lot of people probably don't even know that they have some of these things. And they kind of go hand in hand. If you have high blood pressure or even diabetes, some of these things can actually lead to CKD. That's why it can only be really discovered through routine blood work or urine tests. As CKD progresses, symptoms can develop and become even more noticeable. And I'll talk about that right now because I remember there were times I had unexplained leg swelling. Wasn't sure why my legs were swelling, especially if I'm walking all the time. Wasn't sure why that was happening. The tricky thing is that some of these symptoms are super sly because many of these symptoms can overlap with other medical conditions. You might have one condition, you might think, oh, it's just high blood pressure. No, it could be a product of CKD or maybe even diabetes, or it could be something even more severe. However, some of the symptoms include but are not limited to, especially for CKD, not limited to changes in urination. You might experience some fatigue, some swelling in the lower extremities, or even face due to fluid buildup, like puffy face out of nowhere, you know? You might even, of course, you're going to feel shortness of breath, even muscle cramps for that, because I think there's like electrolyte imbalance that comes with that as well, and even more symptoms. I'm going to actually leave a link to both of these organizations down in the description section so that you guys can go ahead and check out the site yourself and do some homework and figure it out if you have high blood pressure and you just want to learn a little bit more, or even if you think you might be at risk for CKD. I'm going to leave those links down there and you can check out the websites and do some homework yourself. But it's always important, always, and I can't stress this enough, check with your healthcare provider to rule out any possible conditions that could be contributing to symptoms that you are feeling, okay? So let's talk about the diagnosis process. For me, it looked a little bit different because it was well documented that I had high blood pressure. I mean, you just slap on a blood pressure cuff, and based on other readings from my ER visits, they knew. And even some of my primary care physician notes were updated into my chart around my local region. And so they could see the trends of my blood pressure. So the next step was to figure out what was going on with this kidney issue. So for me, the first thing that they started to do was what did they start doing really? Oh, of course, the urine test. They started doing urine test. And then when I went to the nephrologist, my nephrologist actually got me to do a biopsy to see what was going on with my kidneys that increased the blood pressure, because clearly I had some kidney damage. So we went ahead, got the biopsy done, and he actually got me on some blood pressure med control. Now, I was so thankful for that because he brought me down from taking 5 blood pressure meds to now taking 3 blood pressure meds. And so, I mean, no headaches, no crazy symptoms. I just take them and I literally feel my body just kind of relax a little bit. You know, it's funny. When I first started doing the blood pressure management and my blood pressure went back to normal, I remember standing up, trying to go use the restroom in the ER. And the nurse said, "Hey, are you sure you want to get up and use the restroom on your own?" I said, "Yeah, man, I got this." And as soon as I took 2 steps, I got so dizzy, I had to sit right back down. And that usually happens when your blood pressure finally normalizes. And for the first time, I think my arteries actually took a chill. So yes, they did the biopsy. Gosh, and I'll be real, the biopsy felt so weird because it's almost as if somebody taking a stick and jabbing it all the way through your insides and just poking around. You feel them touching your kidneys. Like it's a weird, tingly kind of feel. And it doesn't hurt as more as it's uncomfortable. So they did the biopsy, got my blood pressure straight, and he also went the extra mile to see if I needed and did some genetics tests with the Moffitt group over in Tampa. And the Moffitt group, they did their testing. There was nothing that signified that I had anything that contributed to the high blood pressure. It was just the high blood pressure brought on the onset of the CKD. It is what it is. The blood pressure was so high that it damaged a lot of the nephrons in my kidneys, especially the left one, because that's where they did the biopsy. And that's where they saw that the nephrons were damaged. So blood pressure. I almost feel bad because had I known that it was the blood pressure that was going to do all of this to me, and I've heard it all the time. I've heard it said that, when you have high blood pressure, you can't go on dialysis. I automatically assume that, hey, once you have high blood pressure, you're on dialysis. And I was so afraid of that. And I try to combat not trying to be diagnosed with high blood pressure that I actually didn't understand. I had so many misconceptions when it came to high blood pressure. And I think a lot of folks, especially in my community, me being Caribbean, we have a lot of misunderstandings as far. Matter of fact, I think it even goes a little step further. I think a lot of times too, we take going to the doctor for granted. A lot of times we have a fear of going to the doctor for whatever reason. I don't know if it's because they think, or maybe it's a lack of trust in doctors, or maybe we feel like doctors are just out to get money from us, and try to diagnose us with stuff that we really don't have. But I think a lot of times too, it's not so much so about being afraid of the doctors. I think it's finding the right doctor that you can trust. But I think that's a whole different conversation for another time. So outside of the biopsy, outside of the urine test, outside of the blood work, there's some other stuff that they can do to detect, if you have CKD. One of which is also the MAG-3 scan. The MAG-3 scan is where they, inject you with Lasix through an IV, which helps you urinate. Lasix, it comes either in a pill form or in a liquid form. They pump it into your IV, and they kind of monitor how your kidneys respond to the fluid and try to flush it out. I remember this one MAG-3 scan. This is after the kidney had ruptured. My left kidney had ruptured, and my right one still had the mass on there. And I don't think I had gotten a kidney stent just yet. But I remember they were just monitoring to see how my kidney function would flow. And I remember looking up at the screen. My left kidney was shot. There was no real activity going on, probably minimal. I'd probably say maybe like a 5% activity in the left kidney, but the right kidney was the one that was really doing most of the filtration and the flushing out of the fluids, which told me, hey, look, you're operating probably on one kidney right now. So that's one of the tests too. Of course, the blood work. And with the blood work, they do a complete metabolic panel, or CMP, where they look at how much protein is in your blood. They look at how much nitrogen is in your blood, how much it's called I guess, yeah, the bun nitrogen, and then there's the creatinine, and then you also have your EGFR. Oh, let me talk about that too. So your EGFR is the percentage that your kidney is flushing or filtering blood throughout your body. I forget the actual measurements. However, though, the percentage wise, I know for somebody my age, around 36, I should be around 90% or higher for normal kidney function. And as the breakdown goes, for me, I'm at stage 4 currently. So stage 4 is from 15% up to 29%. And I'm actually right now at my baseline again of 24%, which gives me that stage 4 kidney disease. Again, I will also add a link to the different stages of the kidney disease in the description, so that way you can see how it's measured as far as liters, how much liters of blood being filtered throughout the body to determine the level of kidney disease. And again, the diagnosis process is not difficult, to say the least. First of all, when it comes to CKD, it's just a blood test. If you tell your doctor, if your doctor is going to draw blood, they're going to see your kidney filtration. They're going to see your cholesterol. They're going to see your sodium. They're going to see your glucose. They're going to see all that information in there. And that's easily attainable. All you have to do is just go to your doctor and ask for a blood test to see how your kidney filtration is doing. And I encourage all my friends, family members, even some of you listeners, even the folks who follow me on Instagram, I encourage everybody to go ahead and check your kidney filtration, because you never know. You never know where your kidney is sitting at right now and what you can do in advance to help you stay away from getting chronic kidney disease. As we do age, our kidney filtration does go down. But when you have CKD, it tends to go down even quicker. Like right now, with me at stage 4 kidney disease with 25 liters of blood being filtered, or 25 drops of blood, however it's measured, 25% kidney filtration. Sorry. I have the kidney filtration of somebody who might be in their late 70s, early 80s, to give perspective. And that's just depending on the health of the person, how they're taking care of themselves as well. But on a typical, some usually see folks on dialysis who are either up in age, and I'm already near that. So it is kind of discouraging, but it's not without hope, because there's still things that the doctors or my care teams are doing to kind of help me progress along and kind of manage my CKD. So we talked about the diagnosis process, the different blood tests, the urine tests, the MAG-3 scans. Now let's talk about the emotional impact of the diagnosis. Now, it goes without saying that I was affected heavily, tremendously, because when you get a diagnosis like that can be life-threatening, folks do live with CKD. We can live. I've met some of the strongest, and we call them CKD warriors in my community. I've met some of the strongest folks who live with CKD, and some of them have been living for like 10, 15, 20 years with CKD. And they've done such a phenomenal job with managing their CKD that it's so inspiring. And also we have folks who do have to go the kidney transplant route. We have folks who are in dialysis, so not all CKD looks the same, but it is manageable. You still can live with it. I think the biggest thing that affects CKD patients is when we stop trying, when we stop wanting to live, when we stop fighting, CKD is manageable, but it does come with a toll. Okay. I remember coming out of the surgery, the first bout at Tampa General, where the doctors literally saved my life. I remember times being in that ICU, coming out of the surgery, and looking at my hemoglobin level. Like, I'm a guy, I should be well into like the 15 to 18 levels of blood, and my hemoglobin level was like around 7.6. I was really on the low end because when my left kidney ruptured, I lost so much blood through internal bleeding that they had to give me blood transfusions. They had to give me iron. They gave me so many things to kind of stay afloat. And I literally felt my energy levels drop. And I had to really think like, oh my gosh, this is how it's going to end. But the doctors again did a phenomenal job. Mind you that my GFR, my kidney filtration number, had dropped from that 22 that I mentioned when I was first diagnosed. It had dropped all the way down to 11 GFR. That means I was stage 5, renal failure, and on my way to having complete kidney failure. But the doctors, one doctor told me, dude, you're young, you have so much to live for. We're going to do everything that we can to keep you off of dialysis. And they did just that. They stopped the bleeding in my left kidney. They added a kidney stent into me to kind of help me flush out, the fluids in my right kidney because everything was building up. Everything was building up. I remember my legs, I couldn't even wear regular pants or put on sandals or the slippers at the hospital because my legs were swelled up so bad. And, as far as I said, swolled, they were swelled up so bad. And, I forgot to mention this. One of the biggest, and I did mention this, one of the biggest things that I experienced as far as the CKD, as far as signs goes, I did have shortness of breath. I thought it was just, residuals from the pneumonia that I had. I did have leg swelling. I would wear compression socks just to kind of keep the swelling at bay, to the point where my feet would be so big. Like it was, honestly, I thought maybe it was because I wasn't doing squats. I thought it was maybe because I wasn't walking enough, and maybe that was true. Maybe that is true. I wasn't, causing circulation to pull up and down. And as a matter of fact, I remember getting leg vein ablations in both of my legs because there was some abnormal blood circulation going up and down in my veins in my legs. So I had 2 vein ablations done in my legs, but that didn't solve the problem. It might have helped with something later on in the future, but the swelling was still happening. The pneumonia was still happening. And what's funny enough, as soon as I started addressing the kidney situation, the pneumonia stopped. And maybe because I did get my pneumonia shot and the flu shot this year. However, though, I didn't get pneumonia this past year, 2024, which I'm super thankful for. But those symptoms were real. The shortness of breath, the headaches, maybe the puffy face as well. And it made me feel like I was falling apart. As far as the emotional impact of the diagnosis, I had to think to myself, man, okay, this is my new normal. I can't do the same things that I used to because here I am. I have some organ damage right now. What does this look like for my future? What's going to happen later on? I did carry a lot of stress. I did carry a lot of, mental health problems. I had anxiety. I was depressed. Because, mind you, I went immediately on medical leave and couldn't go back to work. When it was time for the school year to start back over again, they asked me if I was coming back. I just needed another year because I had so many surgeries and procedures lined up, so many doctor's appointments that I didn't want to chance it by going back to work and then maybe missing doctor's appointment, which would push back more dates for other procedures and stuff like that. I wanted to take the time to go ahead and do my thing. With that, of course, I'm the man of the house. I'm the father, I'm the husband, and my wife, she encouraged me, to take some time off. And luckily for us, we're pretty good stewards with whatever we do. She encouraged me to take more time off to get all these medical stuff out the way. I even applied for Social Security disability, but that's another conversation. Not really going to get into that. Don't want to get in trouble by anybody. But yeah, I did take time off, and I did consider the loss of income. I did consider the fact that, I wasn't making money the way I used to. And that's a toll. Me being a guy, especially in today's day and age, being on medical leave and extended leave of absence from work and not bringing in a check consistently, and trying to do things to feel like I had purpose. I think the biggest thing that I felt like I was losing was my sense of purpose, because my purpose was tied into how much money I was bringing for my family every single day. While saying that, I'm not saying that's not important. But when that piece of your life as a man, as a married man, as a father with a son goes out the window because you're dealing with health, that takes a toll. I remember talking to my case manager from my health insurance, and he was telling me when he got diagnosed with cancer, and he said his life felt like it just ended. He might as well had died standing up, because he felt like his whole life was about to be over. Apparently, he's kicking it right now. He's doing this thing. He's working with the health insurance that I'm with right now. Shout out to Am Better Health. And that was just so much more encouraging. But I will tell you this: the biggest thing that is misunderstood or kind of undermined is the mental fight. The mental fight is so real. I also would suggest to anybody who is going through any health crisis or anything medical, I would say get a good therapist. If you don't have a good friend, if you don't have somebody to talk to, somebody who can really listen, somebody who can chime in and check in on you, get a therapist, somebody you can talk to and pour into, and maybe they can pour back into you and give you some hope. Because when you go through a chronic illness, when you go through any kind of medical condition that is life threatening, it is very daunting when you have nobody to go talk to. Now, mind you, most of the times I'm either out of the house, maybe on the road helping my dad, running errands, kind of getting things in place, doing a podcast, doing something. But there are times where I'm not doing all of that. A lot of times the fatigue crashes me out. And some days my energy levels are so low, I don't do anything all day because I just can't. And people mistake that for being lazy. It's not. The most inspiring quote that I remember reading is like, a friend is somebody who can look in your eyes and see the pain while everyone else looks at you and sees the smile and believe it. You know, I think the hardest thing to do is to fake being okay when you're really not. There's so much pressure that comes with trying to look okay, trying to feel okay. I'll be honest, there are times where I would go out, maybe with friends or maybe go to a party, and I try to be myself, trying to enjoy it the way I do, dance, maybe listen to music, have a good time, crack jokes or whatever. But there are times where I don't even want to be there, but I do it for the sake of socializing because I need it at the same time. It's like big double-edged sword. You need the socialization, but sometimes your body just can't keep up with the expectation of being there. And I could go on and on about the emotional impact of the diagnosis, but the biggest thing that I always was concerned about too with the diagnosis was how it was impacting my relationship with my wife. My wife could look me dead in the eyes and realize that, man, this kid is not the same. He doesn't smile the way he does anymore. He doesn't, laugh the way he does anymore. He doesn't really like to enjoy the things that he used to. He's very in his mind. He's really thinking. And there are times I come out of that because I see that it hurts my own family. So there's pressure in that too. And she doesn't put the pressure on me to put the pressure. This episode's based on high blood pressure, right? It's not so much so that pressure. It's just there's a lot to live up to and to fight while you're dealing with your CKD or any condition that you have in. So shout out to anybody who is fighting a chronic illness battle, because I get it. I get it. It's hard to be you, especially when you're thinking about your longevity. Gosh, it's anywho. So that's the emotional impact of the diagnosis. All right. So here's some tips. I'm going to offer some tips for early detection. And it's not much tips per se, but I will say this. Peeps, talk to your doctor. Talk to your doctor to rule out any potential underlying causes. Please. I, for one, did not like going to the doctor. I thought, okay, the only time I need to go to the doctor is if I'm really feeling something bad, I'll go get a prescription and everything will be all right. No, if you need to, if you feel the urge to, please go check out with a doctor, get checked up. You never know what's really going on. And that's the best tip I can give. You might want to get some every year do your annual checkups. Guys, if you're over a certain age, you might want to check your prostate. You might want to, do those checkups. Matter of fact, I got to call my dad and tell him, hey, go get your prostate checked out, dude. Check your cholesterol. Do all of that. Do those checks so that you're good. I know there's a lot of folks who are just trying to pound through the day, trying to grind and, trying to survive. But there's no point in trying to survive if you don't know how your battery is looking. You always want to check with a doctor. And I'm not just saying go walk into any doctor. There's a lot of wisdom that needs to happen when you're going to check out a doctor, okay? Because from my assessment, I know that there are some really good doctors out there. Some really great folks who will go out of their way and come see you on a really early Saturday morning, like 6 a.m., and check on you to see if they're giving you the right blood pressure meds that they recently prescribed to you. Shout out to Dr. Hayes at Sunshine Kidney Health for doing that for me, because he showed me that there are some really good doctors out there that really care for their patients. And it's always good when you have a solid connection with the doctor, because you realize that they get you and they're going to do anything that they can to make sure that you live your best life in that sense. Anywho, another good tip, Quest Diagnostics and all these other lab places, they do walk-ins, and if you have insurance, you can go ahead and request a test and see what your levels are. Even if you don't want to go see a doctor, you just want to do it on your own. You're probably holistic. You probably want to check and see what your potassium levels are. You want to see what your sodium levels are. You want to see how your kidneys are doing. You can actually take your health in your own hands. However, though, if you have any questions, if you don't understand certain things, it's always good to bring your lab results to a healthcare provider, and they can further explain those things to you. But I always recommend going to somebody, your healthcare provider, who actually knows the lingo, the jargon of the medical stuff that shows up on your lab results. Because at first glance, I might not know what a MCH is. I might need somebody to come talk to me, about that. I didn't know what a GFR was. I had a doctor come and break it down for me. So it's always good to get educated on your own body, and always to know your numbers. You always need to know your own numbers, okay? Now, remember, some of the websites that I'm going to put down in the description is for the National Kidney Foundation or the American Heart Association. Please check those out so that you can do your homework as well and read up on some information that'll help you understand further information about high blood pressure, malignant hypertension, as well as chronic kidney disease and other websites. And I'll try to find some other organizations that can drop down there so that you can also take a look into that and see what's going on there. All right. So my biggest question to you guys now is, what has been your experience with high blood pressure? Do you have high blood pressure? Do you not have high blood pressure? Do you know somebody that has high blood pressure? What are your experiences with it? I want you to go ahead and share your stories, maybe in the comment section, maybe reach out to me in a message. And if you have questions, please let me know. All open to discussion. I'm all open to have a conversation. This is not just me wanting to run my mouth for an hour. I just want to have dialogue with you guys and just continue to build and create a community so that we can always encourage one another when it comes to our health journey. All right. So again, guys, high blood pressure, it is no joke. It's literally, with me, with the high blood pressure, I literally wanted to take the pressure off. Just literally take the pressure off myself. Because whether it's the pressure of trying to, fit into some jeans, or the pressure of going to the doctors and getting a good reading, that type of pressure was just too much for me. And I'm thankful that I had the right things happen. Even getting diagnosed with the high blood pressure. I'm glad that happened, because everything started to balance itself out. Okay. So again, share your stories in the comment section. If you have questions, please reach out to me. Let me know. I am also on Instagram at Mr. Cool Beans 2889. That's MrCoolBans8. No, 2889. Oh my gosh, did I forget how to spell? Sorry about that. Please check me out at Mr. Cool Beans. Reach out to me. Let's talk on the Instagram. All right. This is Mr. Cool Beans, and I'll catch you on the next one here on the Brew. Peace.